Welcome back to Yoga Therapy Thursdays. This week we're starting the first in our series on shoulder mobility. And today we're starting with lateral mobility. For lateral mobility, it's really just your ability to reach your arms up overhead and back down. Most of this is done through the muscles that surround the shoulder. Some of this is also a little bit into lateral side bending, and that comes from your thoracic spine or kind of your rib cage. Lateral shoulder mobility is just reaching the arms up overhead and back down. There are several different things that happen when we do this, and there are certain things that we want to try to avoid, like raising your shoulders up to reach your arms up overhead. So when you make this movement, make sure your shoulders are moving away from your ears and you're only going as far as your arms will take you. So someone with frozen shoulder might only be able to get to here, and that's perfectly fine. Hopefully the frozen shoulder will go away in the near future. There are several poses that incorporate lateral mobility in yoga. Something as simple as just a seated side bend. You can also do this standing, or also the kneeling variation in gate pose. There are also several other poses such as side angle, reverse warrior, and triangle that'll also work into lateral mobility. There are several muscles that help with shoulder mobility. One of the biggest contributors to rotator cuff injuries are tight lats, or your latissimus dorsi. They're over here on the sides of your body, and they help you pull down, draw back, and do internal rotation. So if you start to notice restricted movement, you can break it apart into two parts. You could place your hands on your shoulders, keeping your elbows a little bit on the downside, and then leaning to one side. If you continue to pull your belly in as you start to tilt, you'll start to notice the stretch into your lats. If it's really tight there, and that's as far as you've been able to go, then that might be the place that's limiting your movement. If you reach your arms up without the lateral bending, that's going to tell you if the restriction is in your posterior deltoid. Another limiting factor to shoulder mobility is muscle strength. This is generally not the case with lateral movement, but sometimes it is. But let's say you have recently recovered from some sort of shoulder surgery. Increasing your mobility by taking gravity out of the equation will be nice and helpful to help you regain your range of movement. So for this, start on the ground, arms come alongside the body, turn your palms up. This is going to create the space you need to lift your arms up overhead. From here, sweep your arms out alongside the body until you get to a place where you can't go any further. If you can go all the way to the top, then bring them straight back down. If you have to stop along the way, just stop where you need to stop, and then come back to the arms alongside the body. If one side is giving you more problems than the other, it's perfectly fine to do one arm and then the other. Thank you for joining me this week on Yoga Therapy Thursdays. Don't forget to check out my co-hosts, and we will continue our mobility series on the shoulders next week.